and the advantages of personalized care. As far as I remember, Gleneagles Global Hospital itself already has the facility of asthma clinic. Now, I'll just take a very, very simple example of dental care. Dental care, if you look at, a number of people, நிறைய பேருக்கு அது தெரியவே தெரிய மாட்டேங்குது, இந்த அளவுக்கு அட்வான்ஸ்மெண்ட் வந்துருது அப்படின்னு. ஸ்கின் கேர் இந்த அளவுக்கு அட்வான்ஸ் வந்து. ஸோ மெனி ஆஃப் அஸ், ஈவன் ஃபார் அ ஸ்மால் toothache, we keep on suffering without knowing that such a good facility is available. Same thing with asthma. Asthma, you have got so many more new diagnostic facilities which have come. Lung function tests have come, specialized testing has come, allergy testing is there, imaging is there. Even now, over medication with those kind of over medications are there, or generalized medication is there. That is why we go to the next stage of asthma clinic, which luckily you are successfully running in your hospital. And the advantages perhaps when we launch this would also be, apart from personalized medication, I am a great believer in that old family doctor syndrome. Family doctors, அவங்க வருவாங்க, பார்ப்பாங்க, பார்த்த உடனே என்ன சொல்லுவாங்கன்னா something is not well. இப்போ now that is missing. So by the time a patient accesses a doctor's care, it is too late. Particularly with many patients, we find that already the critical time has gone. So now these kind of severe asthma clinic, I am pretty sure they will be able to access personalized. I think just one second. So biological therapy, then again with regard to bronchial therapy, many new techniques common doctors may not be able to prescribe, or when we go it will be based on whatever we get from the government hospitals have a pulmonologist and all. COVID again has brought back the focus on the advantages of முதல்ல எல்லாருமே cardiac arrest, அதுக்கப்புறம் stroke patients, அது மாதிரி சொன்னோம். இப்போ pulmonologists have their own field. Otherwise swine flu season, those seasons, and generally of course asthma is a very, very past this thing. So this exactly severe asthma clinic would give these kind of advantages. But more than anything else, my personal interest in all this has been, I am a postgraduate in veterinary science. I am in fact pursuing comparative biomedical sciences in University of Georgia, Athens. I am trying to complete my doctorate, which is again on One Health. I firmly believe that the advantages of veterinary field over human field is that the ability to do deeper research, because we have a lot of, you are so much hard pressed. So my personal request would be that when you are embarking on this wonderful exercise of severe asthma clinic, you should be able to enlist people who can join together for contributing towards research. This is where I think our clinical medicine is finding it very difficult to come up with newer solutions, because everybody is interested only in treatment, and you are all so busy that you just don't have time for analyzing and coming up with a research article or a peer-reviewed article or something where you can come up with a translational kind of research where you are quickly able to do. When you look at the Zoomabs, Moomabs and all, everybody is hitting a ceiling, no new doctor is knowing what are all the newer developments. Should we not, don't we have a duty to bring these newer medications to people? Should it only for cancer, the kind of monoclonal antibodies or antibodies linked with animals or mice? Why don't we bring these advantages to our own people? And for that, research is very important, and for research you need people willing to join for research. And I am sure when you are having this severe asthma clinic, when you are going much beyond asthma clinic which you are running successfully, you should be able to convince people to be part of this research. I am telling this with a huge sense of responsibility, because when we had this COVID, the biggest problem was we didn't know what was the best clinical combination which we will do. So we were all continuously experimenting. Even now we have 150,000 chest x-rays we used to take. Should we not use AI to look at the other lung parameters? Should we not have focused, should we not focus on that day, all these imaging people were focused only on COVID? Should we not use AI to do greater research? Why only asthma, TB cases? We could have diagnosed. So a huge set of opportunities come when these severe asthma clinics are in place, and patients will take advantage. With regard to this side, I think Chettinad Dean Madam is there. My other concern is, as a former health secretary, always the challenge of OMR, ECR, very, very rapidly developing, but having quaternary and tertiary care institutes is few and far between. Suddenly there is a crisis, means you feel better to rush. If you go Mahabalipuram, nearest that side, Chengalput GH irukku, in the Pakam Chettinad irukku, of course Sai and all other far interior. So this side you have got Gleneagles Global Hospital, which is again a very wonderful hospital. But I think this is one area when we offer huge crowd is there, and asthma is something which is very common. It is not as if it is a rare disease or something. So giving solutions to asthmatic patients, giving relief. You've seen when a patient with asthma is having that bout, how much he is suffering. So that is where I think the severe asthma clinic is going to really take this to the next plane. I congratulate Gleneagles Hospital. They always come up with newer ideas. They don't sit back and relax with whatever they have done, and sit back that one they are doing very good transplantation, they are doing X, they are doing Y. You come up with unique kind of such interventions which make these kind of facilities popular. Media friends are there. I'm sure they will take these services to the thing. Last but not least, my appeal to doctors is, I request all of you to come more and more in the common forum, popular media and articles where you can tell people about the advances which are, because many people continue to suffer without knowing the advancements and the relief. But today breast cancer medicine has crashed. Not like 9 injections costing 5 lakhs. It has come down. Stent cost has come down. So similarly, many of your advancements have made it affordable. We have a very robust CM health insurance scheme, Ayushman Bharat scheme. Of course, there is so much more to do in that. But these are something which you can bring to the knowledge of patients. I am sure these kind of newer efforts will take you to the next level, and you will touch the horizon as far as services are concerned. Already we are known to be the medical capital of South Asia. I am sure with this affordable care, I still go with a lasting image. Maybe not a right example to end my speech with. 2015, severe floods, and we were doing the rescue operation, and we are in a boat going to your hospital. Then I found another man swimming, a foreigner. I asked him, where are you swimming? Sir, my patients are there. I live in a service home nearby. But then it made me realize that so many people from all over this, many other countries are coming, and after treatment they go back, live in your service apartment during this thing. But that Tamil Nadu and Chennai in particular, and hospitals, quaternary and tertiary care institutes are providing state-of-art care is something which I am very proud of, and I am very proud that I was associated. Now I am associated more with nutrition, which is again in a way linked to this when you look at social determinants of health. So we all should continue to work together and make these kind of things very popular. என்னோட நண்பர்களுக்கு சொல்கிறது மிக ஒரு சந்தோஷமான விஷயம் தட் இந்த மாதிரி எல்லாமே அடுத்த கட்டத்துக்கு போகிறோம். பிரைமரினா ஆரம்ப சுகாதாரம், அதுக்கப்புறம் நடுத்தர செகண்டரி ஹாஸ்பிட்டல், டிஸ்ட்ரிக்ட் ஹாஸ்பிட்டல், தாலுக் ஹாஸ்பிட்டல், அடுத்தது மெடிக்கல் காலேஜ் ஹாஸ்பிட்டல் தேர்ந்து ஒவ்வொரு ஸ்பெஷாலிட்டிலையும் அதுலேயும் ஆஸ்மா கிளினிக்கு தாண்டி சிவியர் ஆஸ்மா கிளினிக்குன்னு இவங்க கொண்டு வரது நம்ம ஒரு மெடிக்கல் லெவல்லையே ஒவ்வொரு நோய்களுக்கும் அறிகுறிக்கும் அடுத்த லெவலுக்கு கொண்டு போகக்கூடிய வாய்ப்பில் என்ன அழைத்து அவங்க லான்ச் பண்ணுறதுக்கான வாய்ப்பை கொடுத்ததுக்கு அனைவருக்கும் நன்றி கூறி விடைபெறுகிறேன். நன்றி, வணக்கம்.